You have been referred to ENT, speech and language therapy, because of a problem with your voice box or throat. This could be a change in your voice quality, usually a hoarseness. Your voice may be rough or breathy. It may feel weak or effortful to produce. Some people may report a change in the sensation in their throat. They may feel a pain or a pressure, a tickle or a lump in the throat, or even a choking sensation. The throat may feel tight or achy, it may be dry or sore, or you may be experiencing a burning sensation. In response to these symptoms, you may find you are coughing or throat clearing more than usual. Or for some people, these changes in sensation may cause symptoms of breathlessness. Before starting speech and language therapy exercises, it can sometimes be helpful to understand how the voice box and the muscles in the throat work. This video will look at normal movement. When you first visit the ENT department, your ENT specialist may carry out a video laryngeal endoscopy. This is an examination of the larynx or voice box. During this procedure, a small, thin, flexible tube called an endoscope is placed in one nostril and gently passed through your nose to the top of the throat. This is a straightforward, routine procedure and should not be painful. On the end of the endoscope is a very small camera. This allows us to see images of your voice box on a monitor. We can record these images and show you them after the procedure. Whilst the endoscope is in place, we may ask you to do some exercises to see how the muscles in the throat are working. This helps us plan your treatment. The following images are taken from a video laryngeal endoscopy procedure. The images show a normal voice box with normal muscle movement. When the endoscope is in position, we can see two white bands. These are the vocal cords. The black space below the vocal cords is the entrance to your windpipe. At rest, the vocal cord should stay open in a V-like position. This is to enable nice, easy breathing. If these muscles tense and close at rest, you may experience a tight sensation in the throat and possibly symptoms of breathlessness, particularly difficulty getting your breath in. The main function of the vocal cords is to protect the windpipe to stop anything from entering the airway. When we swallow, the vocal cords as well as the surrounding muscles in the throat will close. The image on the screen will turn white. When these muscles close, it means that the windpipe is completely protected, and so during the swallow, food and drink cannot go down the wrong way. If something does block the windpipe, for example when food or drink goes down the wrong way, the vocal cords will slam together. This is what we do when we cough. The reason we cough is to get rid of something from the windpipe that should not be there. If you are coughing in response to a changed sensation in the throat, such as a tickle or an itch, the cough isn't helpful. It isn't clearing the airway from any physical obstruction. Dry and irritable coughs can actually lead to irritation in the throat and voice box. The other function of the vocal cords is to voice. When we voice, we open and close the vocal cords really quickly. This creates a vibration for sound. To get a clear voice quality, the vocal cords should be healthy and white. The edges of the vocal cords should be smooth. And when the vocal cords open and close, the cords should meet along their full length and move in a wave-like fashion. We can use a special light called stroboscopy to see this wave-like movement. Your speech and language therapist will talk to you about changes to the muscles in your throat and voice box.